The main goal of our residency program is to train competent generalists who can go out and manage everything. We provide excellent training so that people can come out with both surgical and obstetrical skills necessary to provide general OBGYN care to anyone in the United States.
We see the sickest of the sick, and we see every disease you can possibly think of, and we're here and ready to take care of them.
So when I was looking for a program, what I cared the most about was the culture. So our culture is like second to none. We have such a special relationship with all of our attendings. I know them all on a personal level, and they're incredible mentors in my life. You pair that with like a great surgical training, a great academic experience, and it just makes for the best training.
What was most important to me was going to a program that served a very diverse patient population. I wanted to make sure that we were serving patients regardless of their insurance status.
MetroHealth is a special place because of the patients we serve and the commitment to serving underserved patient populations.
Metro is the safety net hospital for the city, so we never turn anyone away. We figure out how to get them the care that they need, which as a physician, it feels so much better to know that there is not going to be a barrier between this patient getting what they need. For their pregnancy, for their GYN care, for their hysterectomy, we will meet them where they're at.
That's one of the best things about working at Metro, and one of the reasons why I wanted to come here was because you do get a whole wide array of patients.
I really love the fact that Metro is committed to holistic health, committed to addressing all of the physical ailments that patients have, but also meeting them where they are and addressing their social needs.
Literally from day one, I was like, these are my people.
At MetroHealth, we see patients that come from all over the world. We encounter a variety of languages. So just as much as we teach our patients teach us a lot.
We're looking for residents who are engaging, who are empathic, who the mission of Metro speaks to them. This is a very patient-centered place. We're looking for residents and people who want to work with patients from all backgrounds and all walks of life.
I look for high levels of emotional intelligence, high levels of teamwork. There are residents who are tender, there are residents who are tough. Our residents have to be both. We do really, really, really hard stuff, and we have to be really, really kind. And so it's a special group of talented people that show up that way.
Our residents currently rotate primarily at our main campus in downtown Cleveland. They do spend time at our satellite locations when they're doing outpatient surgical procedures, as well as subspecialty clinics.
We also rotate to the VA for a few rotations, so that's also a different patient population. And we go to preterm to learn abortion care as well.
The new hospital just opened a couple of years ago, and it's beautiful. Our new labor and delivery has huge birthing rooms. They have gorgeous picture windows for our patients to have while they're in labor. The patients can have tubs on labor and delivery if they'd like, and there's even the lights in the ceiling for our pelvic exams, also double as mirrors so patients can look while they're pushing if they want to.
We also have a great antepartum unit and high-risk unit. They all are able to have telemetry on them now, which is great.
We get them into absolutely everything we possibly can. So they're doing repairs the first day, they're doing appropriate primary C-sections their first day. We're making sure that they're going into every single room, and that when they're ready, when they can do their exams, they can put in their Foley balloons, they can do their own second-degree repairs. We let them fly, but we're there with them the whole way until they get to that point.
I love teaching surgery. It's my most favorite thing to do, and so having them in the OR and showing them the anatomy and showing them how to perform things and watching them get it is one of the most rewarding parts of working with trainees by far.
When we're in clinic with the residents, they're able to see all of the bread and butter cases. So that would be patients with hypertension, diabetes, but they also get exposed to patients with complex fetal conditions. So they are right along with us when we're evaluating patients. When we are inpatient with the residents, they are again frontline, seeing all of the patients that come in with complications that require admission. So we see it all, and so they get to see it all.
Literally day one, July 1st, I was doing a C-section at 7:30 a.m. So I've gotten to do a lot of things already in just a few short months, and I'm really excited for what's to come. I'm on my gynecology rotation, and it's really been fun seeing how I've grown since intern year. I'm doing laparoscopic hysterectomies now and robotic hysterectomies, where the attendings they'll sit on the console with me, but let me do the entire hysterectomy by myself, which is so much fun. Starting intern year, you do start operating day one, but more with minors and kind of gradually work your way up.
I love seeing our residents grow into confident, compassionate physicians. Their energy and curiosity inspire me every day.
There is no part of patient care of which the residents are not in part of and included in. We have a full-service urogynecology and reconstructive pelvic surgery practice here. We offer the full depth and breadth of all approaches to complex benign pelvic surgery, laparoscopic, robotic, vaginal approaches. Residents and trainees who come out of here are fully trained in all different approaches and are very comfortable being able to perform many of these surgeries in practice.
We have a huge number of medical students and trainees from Case of all types, not just medical students, and that's been going on for a century. In Cleveland, the history of Cleveland is a top tier, top 10 educational infrastructure for all of healthcare in the whole country. So it has a long, proud history that we're central to.
Medical students are present with us on all of our rotations. They're on labor and delivery with us, they're in clinic and the GYN OR. We help with clinical education, we help them learn their place in the OR and what to do in the OR, and they come to labor and delivery and learn about the full scope of labor and delivery and how to manage patients there with us.
We do have a ton of resources available to us in terms of like mentorship and research, and we get to work with a lot of learners, medical students and other residents, but at the same time, it feels like that community program, it feels really tight-knit, everybody knows each other, and we're really ingrained into the patient population in our area. I also wanted somewhere that could help you get to a fellowship one day or be a generalist because I was undecided, and I feel like we do a really good job about training you for a wide, like really all the different specialties if you want to do fellowship, but also you can come out a very strong trained generalist.
Over the past few years, our residents have had great success with obtaining positions in academic generalist medicine fields, as well as fellowships including maternal fetal medicine, urogynecology, minimally invasive surgery, and family planning.
Cleveland is a lovely city. It's not too big, but it has all the things you want in a city.
It has a great food scene, both food and drink scene. The lake is beautiful, beautiful green space.
Cost of living is much more affordable here, and people are really nice because it's the Midwest.
For those who are the outdoor enthusiasts, our metro parks are one of the best in the country.
It's a great place to live and raise a family.
Something I really like is that we have the Playhouse Square district here, which is the second largest place for musicals, second to Broadway. You can go to all the Guardians games, Cavaliers games, Browns games.
We always are going to different like happy hours or patios after education and getting together on the weekends to go to housewarming events or just hang out together. So a lot of times PGY classes will also do special dinners together where they'll get together, grab dinner, catch up. So it really makes like ultimate best friends.
What I enjoy the most about working with the residents is watching them go from a minimal knowledge base to that I get to consult with them and get their expertise advice.
I love to teach the residents because when they come in, they can barely crawl. And at the end of residency, they can run.
They make you better. You've got to be on top of literature, you've got to be on top of techniques. You've got to take that responsibility really seriously that you are training the people that are going to take care of your family.
Come to MetroHealth if you're looking to work hard with people you love.
If you are looking for really taking ownership over patients and meeting them no matter what has brought them to this point in their life.
If you're looking for an incredibly supportive collegial environment with a depth and breadth and diversity of patients.
If you are looking for an experience that will prepare you to take care of any patient anywhere.
If you're looking for a program where you feel like you'll really fit in and you'll feel like you're part of a family with your co-residents.
If you're looking for a very supportive work environment that will get you to your fellowship or generalist training goals and get you a great surgical and clinical training experience.
If you're looking for camaraderie, expert clinical experience, and a lot of fun.
Come to MetroHealth if you want a state-of-the-art training experience, you want to work with some of your best friends and learn so much in your time.
If you're looking for a positive work environment, a group of people that really cares about the work that they're doing in the community that they're in, and if you want to have fun at work.